We are, woo, all right. Well, we are considered, I guess, the glamour gals again. One of our patients has nicknamed our lovely quartet of people here. And we have to say that Stevie is normally here, but Stevie tonight has a daughter who is not doing well. She's not feeling well. She's a little sick. So she is at home taking good care of her little one. And so we all just wish her, quick recovery. And of course, as we're going to say, I'm Dr. Margaret Foley here at Foley Vision Center. We have our lovely Lauren Carey here from Cynosure, who's helping us out tonight. She's going to be doing our presentation on IPL and everything you want to know about IPL. We're going to be talking about mostly spot treatments of pigment and rosacea, which helps us address the ocular surface dry eye. It's part of what we do in our protocol here for treating dry eye. I get to be the patient this time around, so yay, I get a treatment, which is really great. That's why I'm looking so deathly pale right now, because I have nothing on. So you're seeing the real me, so that's it. I have no problems. I love my wonderful masks. I can hide behind them all day, but it is wonderful, and it starts with good skincare too. And as we're learning from going to these meetings about the pH of our skin, it's just as important as the pH of our eyes. It's so, so important that we take good care of our skin and prep for these appointments to be getting the bulk and the boost that these treatments can give for our ocular surface. We've got Miss Amy here, who's gorgeous and lovely, and she is our radio frequency technician. She's going to be playing double hats here tonight. She's going to be Amy and Stevie. As you know, Stevie gets to do all the fun stuff with the prizes at the end. So you got to stay to the end so you can get one of those great prizes. We're going to be giving some really great stuff away tonight. And we have Gabby, our advanced laser test. I can't talk today. Advanced laser esthetician. There we go. It's been a long day today, guys. And
it's been a long day.
We've been going since 6:30 this morning, so we are ready to go. And so Gabby's going to be showing us and sharing some really nice tips on doing these particular procedures on me, of course. And you get to see how we do the dry eye treatment as well as a nice pigment touch-up treatment. The left side of our face gets more sun damage. And boy, this summer, I hate to say it, I was wearing my SPF. Thank you, Gabby. But I did get some sunspots from this. And so she's going to magically whisk those away for me so I can start looking more smooth, but also deal with some dry eye issues too. So we're going to be sharing that tonight. Please feel free to put a little thing in the chat box if you have some questions. We're going to do Q&A after we do the presentation, after you guys get to see the live treatment on me. And we want to hear from you. We want to know what's on your mind, questions you might have, things that we can do to help make you understand how we utilize these fantastic energy devices. And on that note, I'm going to let Lauren take it away.
Okay, thank you, Dr. Foley. Hello, everyone. I see we still have more people joining us, which is wonderful. So I'm going to share my screen, and what you guys are going to see come on here is going to be some before and afters here shortly. So am I sharing my entire screen? No, just the pigment. Okay, perfect. Okay. So what we are looking at here is going to be some pigment before and afters. That's kind of where we're going to be starting our discussion around IPL. So IPL is intense pulse light. What it is going to do, it is actually going, so basically within lasers, right, they're targeted toward chromophores, which is just a color. So whether we're doing laser hair removal or we're doing brown spot removal or we're trying to target reds in the skin, those wavelengths we are using are focused toward that. So when we do these treatments, we actually are able to leave the skin around that area we're targeting unharmed and untreated. So what we see when we do something like an IPL treatment for brown spots is we're going to be reversing those signs of sun damage. So like Dr. Foley said, oftentimes you may notice that you'll see sunspots on the side of your face that gets more sun while you drive if you're in the car a lot, or if your hands are up on your steering wheel and you're going around, you're going to sometimes often get those brown spots there more commonly than you will in the other parts of your body. So we're going to be doing a face treatment tonight, but this is something, if you have sunspots on your hand or your neck or your décolleté, you can always come in and get those treated. So with IPL, we can also reduce uneven skin tone and clear rosacea, and also remove unwanted facial veins. So it is a light-based therapy that is going to come in and target this. We're also going to be triggering your body's natural healing response as we do this. So the first picture we're looking at here is a before and after, just one treatment. So everybody needs a different amount of treatments, and that's where the consultative process with your laser technician in clinic is going to be super important. They have the experience and the knowledge to evaluate your skin and identify whatever appropriate treatment plan there is for you. So for me, for example, I have at this point now had 2 IPLs with the Max G by Cynosure. It's really crazy, you know, because when we do these treatments, we're stimulating a lot of natural kind of cell turnover within the body, neocollagenesis, and then obviously those lasers are looking for that pigment. And so sometimes you notice, like for me, I actually can see the pigment in some areas a little bit more, which definitely indicates I need a few more treatments. For my reds, I've gotten beautiful clearance with them with the Icon. It's a super powerful IPL platform, so there's lots of them out there that are available. But part of what makes this so incredible, especially in the optometry space, is that it is very powerful. And so we are able to get a really great clinical endpoint achieved with maybe less treatments and less downtime than we might with others. So with the pigment, we're going to just scroll through a couple here. So you're going to see different amounts of treatments per patient, and that just kind of goes back to what we're talking about with everybody does need a different treatment plan. So this was one treatment, and as you can see, her skin even has a little bit more of a glow after that. Like I said, we'll treat the hands, the wrists, so we're able to kind of remove those sunspots or liver spots with the IPL. As you can tell, I mean, these are some pretty cool before and afters just because it just demonstrates the efficacy of this and the power of the platform. One thing with the Icon that I really love, and I know Dr. Foley really loves, is it has this built-in technology called SkinTel. So it is a melanin reader. So in our skin, we all have different amounts of melanin, and it determines that informs the provider the amount of energy your skin needs to get the right clinical endpoint and ensure your safety during the treatment. So with SkinTel, we actually take a little device, it's about this big, we put it on the skin, and we are actually able to read the melanin index. So what's so powerful about that, beyond just choosing and kind of helping educate ourselves on what the appropriate treatment parameters are for that patient, is that sometimes, especially in the Northwest where we live, not all of us are getting a lot of sun exposure. So we may appear to be a lot paler than we actually are. And so the less melanin you have, the higher energy you can safely use. So that's where it kind of comes into play, where that mechanism is so important. Whether you're a provider or a patient doing these treatments. So what we'll do is we'll read the melanin index, and then that little smart technology will read a Bluetooth signal over to the Icon, and it will let it know what it recommends as far as treatment parameters for what you're trying to work on. So here's another one, just one treatment. We love it. That's beautiful. So this was 3 treatments, and you can tell her nose redness is reduced. She's really gotten a really quite beautiful result there. And then you can even tell her skin's in better condition than it was before. Even if we're just doing an IPL treatment, because of the energy we're putting into the skin, that energy stimulates the body to create new collagen and elastin. So you are going to see an improvement in your quality of skin as well. Here's one treatment. So one thing that this reminds me of is, right, when we're doing treatments, we always want to know, especially when it comes to laser, what our downtime is. With the IPL, when we're doing a pigment treatment, what we're actually doing is we're hitting that pigment, and the result of it is it starts to kind of lift off the skin and slough away. So like for this lady, she probably had kind of a coffee ground type thing as her skin's kind of sloughing off, and she's just getting rid of that unnecessary pigment that's been caused by the sun. So as far as downtime goes, like, you're going to come in, you're going to have your treatment. We do not numb you for an IPL treatment. So you don't have to build that into your schedule. So basically you come in, you get your treatment done. Depending on how many areas we're doing will inform the amount of time, but it's relatively quick. And then we're going to slap some nourishing, delicious stuff on your skin, and hopefully some sunscreen as well. You're going to want to avoid the sun, direct sunlight, for at least a couple of days, and make sure that you're just hydrating and healing your skin through the process. But overall, you don't typically have a lot of downtime with these treatments. So a lot of these are 1, 2. We've got some really beautiful results after 3. Here we go, before and 1 month after 3 treatments. So another thing to know is with the process of creating new collagen and elastin in the body, you're going to receive a maximum benefit 6 months after your last treatment. So whether we're talking about temperature, radio frequency, or the icon, that's kind of what we're looking at as far as the way the body works in response to this type of therapy. Oh, I love that. That looks nice. Yeah, that's a good one. Okay, and this is beautiful too. I even like, I mean, man, look at that rosacea we cleared up there. And then we also, fine lines and wrinkles looking a little bit better too. Okay, I love it. So that's that for my pigment photos. Did we get any Q&A or anything? No questions yet? Okay.
Well,
Dr. Foley, yeah.
yeah, I wanted to bring up the fact that you touched on, I think, a really important thing right from the beginning about the difference between Cynosure's IPL device versus other companies. The whole reason why I chose to go with Cynosure's IPL versus a number of other companies, and I did a lot of due diligence and research, is because of the melanin reader. I had been at one of my colleagues' practices and was watching how she was doing the IPL procedure with a different device, a different company's device, and the patient got burned because we both thought the patient was a skin type 2, and we're talking about Fitzpatrick scores. It's how light are you, how dark are you, how much melanin content, and really all we've had up until this point in time, until this melanin reader came out, is you had to eyeball people and kind of guess. And I don't like guessing. I'm the scientist at heart, and I like clear, definitive endpoints for clinical in effectivity. And so that freaked me out that this patient was actually had much more melanin content in their skin than we realized. So we put it on a higher energy setting based on what she looked like. She looked like you, Lauren. She looked beautiful, kind of whitish, you know, very, very pale. But she is like a skin type 3. And we were like, holy camoli. So the moment I saw the melanin reader, I was like, okay, this is safer, much more effective, gives me apples to apples comparison. And I don't know about you, Gabby, but how do you feel? You've had even more experience than me using lasers and whatnot.
Yeah, there's definitely some times where the melanin reader has saved my butt because I've had someone go to Hawaii or Mexico or somewhere beautiful and warm, and I see them, and it's been a month since I saw them, so I'm here like, are you tanner? And we do the melanin reading, and it is way higher than last time. And I'm like, yeah, you definitely lied about your sun exposure. You got a little bit extra than you should have been. And so there's definitely times where if I didn't have that, I might not have remembered from last time how light they were before. So it's definitely very helpful. It makes you feel better too, because either way, how you look at it, you're running like a laser device. That's a big deal. So it's definitely kind of gives you some peace of mind.
Agreed. I can't imagine being a practitioner in this day and age without having that. And as far as I know, and Lauren can, let me know this, but as far as I know, Cynosure is the only laser company that has this. It's patented, so no one else has this ability to be testing the skin. And we do 5 different places on the face to get a really good average. We did have a question come in asking about what is the frequency of these treatments? And, when we're doing dry eye and we're dealing with ocular surface, we generally do anywhere from 4 to 6 IPL treatments spaced about 4 weeks apart roughly. And that's to maximize collagen and elastin remodeling, but more importantly, to really get at the rosacea side of this. And that's one of the questions. Oh, we've got a couple of them here coming up. This is great. And we have another one. Terry says, Gabby is really good. She also is asking, we have some reddish pigment areas under the eyes on the top of the cheeks. Does the treatment provider have to use different settings for different areas of the face? I'm going to let you guys answer that question.
So at least how I treat for rosacea, acne, anything with reds in the skin, there is a certain settings for kind of the red pigments. So normally what I like to do is we'll target any dark spots first with those dark spot settings. And normally redness is a little bit more spread out. We'll have it on the cheeks, under eyes, around the nose, where then we will kind of go across the rest of the face with those redness settings. And then here we do a second pass around the eyes, not only for dry eye, but also it helps target a little bit of extra of that redness that we get around the eyes. So yes and no, because it's general rosacea settings for redness.
Yeah, I also want to add that just like to kind of full picture on the question, Terry, a really great provider is probably going to use a lot of different treatment settings while they're doing your treatment, because they want to make sure, look, like this side of the face doesn't see the same as this, doesn't see the same as this. So it's a great question, and they probably will change it during the treatment, and that's kind of a good thing. So.
And yeah, I love that. That was a really great question, because it even made me start to think when I'm lecturing to make sure we talk about that. And that is one of the differences between Cynosure. You can do that intermittently very quickly in adjusting the settings versus some of the other laser devices do not do that. They have one set setting and that's it. You can't change it, which means we can't customize it to that patient. Well, what I'm going to do now, guys, is I am going to highlight Gabby. I think it's great for Lauren and Gabby to chat, because I have to be the patient. I got to zip out of my little room. So you're going to see my chair going to be empty. I'm going to mute myself and I'm going to let you guys, you lovely ladies.
All right. Well, I guess we can touch on the Cool, Calm, and Corrected serum. So we are going to be kind of promoting it for this event. So Cool, Calm, and Corrected, it is going to be a phyto serum that has a whole bunch of benefits. It has antioxidants, which is great during the day. Some chlorophyll, which not only helps reduce visible redness without having like any dyes in it. So it's fantastic for rosacea and acne skin types and kind of any sensitized skin. We also have a little bit of melatonin, which of course is going to be calming in that serum. And 40% of people in a study had immediate reduction in discomfort post using it. So it is fantastic. It's like my IPL best friend with this serum. But yeah, I mean, that's kind of, it's amazing. I love this stuff.
I love that. And when you said cool, Gabby, you reminded me to mention and touch on. So with the icon and with any laser in general, like we're working with heat. And so something that's super awesome about the icon, and the icon's a Palomar platform that's been around a long time, right? So we've had a lot of opportunity to continue to evolve it and to grow it and expand with the capabilities of it. So that's where we've added in SkinTel. But the other thing that we have on there is an advanced sapphire cooling mechanism. So when we actually pulse the laser, it's followed immediately by this extremely cold sensation, like not too cold, like the perfect amount of cold. And this is coming from somebody that's had this treatment done a couple of times. I've also had RF microneedling done. I've had temperature done. I've had PicoSure skin revitalization done. Like I could go on and on and on. And see you laughing at me, Dr. Foley. So, yeah. So basically just, it's something that like, as we do the treatment, the provider will rub it on your skin and it will just cool down any of that heat that we're creating during the treatment.
Right.
Yeah. So I just wanted to mention that because it's definitely a total added bonus from the patient perspective. And then you're less of a pain in the butt for your provider because you're happy.
Oh, I've had people where, you know, I'll ask them like, okay, you want me to continue icing this cheek before I move on? And we'll be there for a couple minutes. And they love it so much because it's just like a little ice cube. And I've had people think like, so how did you, you know, disinfect the ice cube that you're putting on my face? Like, it's the handpiece.
It's a handpiece. Yeah. Don't worry, I cleaned it with alcohol first. So, and Gabby, you're just cleansing Dr. Foley's face to clean it off. What's kind of your prep that you do for your IPL patients?
So Dr. Foley made it easy for me. She already has a clean face. So normally it'd be cleanse and then alcohol prep, which is of course everyone's favorite because it's nice and stinky under the nose. After that, because everyone loves the goggles so much. I put the goggles on, and it just makes it easier because I don't like to shine a bright light in people's eyes and blind them while I'm looking at their skin. So I can put the goggles on
yeah.
and then we can do the melanin reading and not, be too mean to them. Here, let's give. Okay.
Perfect, Gabby. That's great.
All right. And I like to put cotton down because these are so cold and, no laser goggle is comfortable. Go ahead and lift your head up for me and relax.
Yeah, and I like the gauze pads just because it's definitely a comfort thing. And then especially Dr. Foley, please cover your ears. But if you have false eyelashes, we don't want to mess them up. If you ever come see Dr. Foley, you better rip those suckers off first. Your eyes are full of nasty little mites when you wear those. Yes, they look glamorous, but get an eyelash serum instead, okay? When I met Dr. Foley about 1.5 years ago, I sat in on her dry eye lecture, and I will never forget this for the rest of my life. I was a big false eyelash girl. We love to just bat those things. Not worth it. Get an eyelash serum. I won't even educate you guys on this, but it's gross. Just know that. But the little cotton pads we can actually put down if you've got, the false lashes on a patient, to cover those up and protect them. I know, right, Terry? Yeah, her shame on me. I know. And then Terry here, while you're getting the melanin reader prepped, Gabby, Terry had a great question. Just wanted to position this to you. So she says, I want to look great in January for my son's wedding. Can I over treat for acne, rosacea, and wrinkles?
I mean, I don't think so, but also I'm an esthetician that I'm doing stuff to my face all the time. So I'm kind of in a different boat where I'm here like, do more.
Exactly.
Like chemical exfoliants and certain kinds of facials. Yes. With IPL, it's kind of, as long as you're not doing too much to your face all at once, like, oh, I'm doing a facial today, then next week I'm doing a chemical peel, then you don't want to stack too many things. I kind of like to go by the rule of do one thing a month. That's kind of, just not to do too much to your body. For some people that have really tough skin, of course, you don't want to mix chemical peels and lasers, but, doing a facial, then a couple weeks later, maybe doing a peel or something like that. For some people, their skin can tolerate that. For others, I cannot imagine doing that on them.
Right.
So it's kind of just depends on what your treatment plan is. It's different for everyone. If I could IPL my own face, I would be getting it done every single month.
I love that. Yeah, because it works nicely, doesn't it? Well, and like to your question, Terry, I think it kind of goes back to that consultation process. It doesn't matter if you're coming in because you want to treat ocular rosacea, or you have unsightly sunspots you want to get rid of, or you want to make your skin look more refreshed and youthful. There's always going to be a perfect treatment plan that we're going to kind of start you off with. And then obviously we can reevaluate your skin. But I would say, to Gabby's point, like have kind of that treatment plan built out so that you can achieve the desired result by the wedding. You can never start too early for this stuff. I have one customer that did an actual like prep for the wedding with her icon with one of her patients. And, she started like 9 months probably before because she had a lot of things she wanted to do. She wanted to do permanent hair reduction, the Botox filler, like she wanted to do the whole gambit of medical services, including IPL. But it's just something to keep in mind. Like you can never start too early. And then we can always tie other things in like medical grade skincare to kind of help, move things along even faster as you're going through laser or facial, etc. So I will pass it back to you if you want to talk through what you're doing right now.
Yeah, so I know it's kind of really like washed out there. That might be easier for you guys. I can see. So we have this little dark spot and it's so light. I can't believe this one bothers you. So we're going to have a special setting for this little one. I don't know if you can see that tiny little, it's so very light. And so we're gonna pick out some settings to kind of spot treat that little guy. And then afterwards, we'll see if there's anything else, but Dr. Foley has some amazing skin, so I'm not too worried. So I'm gonna switch over to my really cool goggles.
Yep. And we wear those in the treatment room to protect our eyes from this light, guys. So this is intense pulse light. Emphasis on the intense. Okay. So we want to wear protective eyewear and not expose ourselves unnecessarily.
And even with these on, I still get like flash grenaded. So you kind of have to have that little blink response ready to go. And it definitely, my first month here, I think I was like going home with migraines every treatment day just because of how bright it is. Like doing IPL day is no joke. Okay, so we have our little hole punch, and this guy, we just put the little spot in there if we can, because I'd like to be able to do different settings surrounding it. And so I'm just gonna ice the skin down a little bit. I don't like to ice too much when treating around kind of rosacea areas because cold will constrict the blood vessels. And I like to make sure they're nice and, you know, ready to receive that light. But for dark spot, I'll make it a little bit more comfortable.
Okay. How sweet.
Right. So we're just gonna go right there with the hole punch. I might actually just go ahead and okay. 3, 2, 1. And then I like to watch it immediately go dark.
It's so satisfying.
Oh yeah. I know. I get so upset when I see the little telangiectasias go away, the little veins around the nose. Because I do that blink response and I open my eyes and they're gone. I'm like,
it's fun to watch them shut down. So
I know,
we'll kind of
want to record it.
I know. So we'll kind of touch on it here in a minute. So are you gonna do any more pulses on her brown spot?
I mean, this one, that got some really good darkening. So I'm just gonna stick with that. If this was a treatment, we would go ahead and then continue with our rosacea setting. So I would go to a different setting and I would be just stamping pulses, kind of starting here and just boom, 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 and just stamping those pulses throughout the face. For, you know, the essence of not having you guys watch me just do this, we're just gonna do the around the eyes treatment, which is just like a little goggle. So it'll be our second pass. So imagine I've treated the whole face and then this is our second pass that we do here special. But
we want to talk about the setting or some docs.
Yeah, okay, so for the doctors, so I like to first, of course, treat my dark spots. And depending on if we have dark, medium, light, dark spots, then that will kind of determine what I am treating at. After that, I like to treat at the rosacea settings, which with the icon on a Fitzpatrick 2, that's going to be 15 milliseconds, anywhere from like 32 joules per centimeter. And like really the highest I go is like maybe a 38. I don't like to, you know, I don't think I've ever had someone that has had to go higher than that. And then same thing with the Fitzpatrick 3, it's just 20 milliseconds so that we have a little bit more time for that thermal relaxation so that we're not overheating the darker skin tones, because overheating is what causes some post-inflammatory hyperpigmentation, which is also why that icing tip on the Max G is so amazing. Helps cut that down a little bit. And then we go through that, and then am I allowed to share the secret eye settings?
Yep. Oh yeah.
So after we do our 15 or 20 millisecond rosacea settings, with whatever energy gives you the clinical endpoint of a little bit of flushing, then we go in with 5 milliseconds and 14 joules. And this is just, it's enough to give kind of a little bit extra without it being too intense on the skin. And we just go right around the eyes. I'll try not to block so that you guys can see what I'm doing. I like to take a little piece of cotton because with the Lux lotion, it makes it a little slippery. And I like to pull down on the skin because we can get a little bit closer to that delicate under eye skin when we are using these lighter settings.
And for the patients on the phone, like you guys are seeing, this is super quick. The icon can fire very fast and we're going from pulse to pulse. So you're really not going to be in treatment room for more than 30 minutes most of the time. And, I'm sure Dr. Foley, when she gets back on camera, will be able to see, kind of how her skin's responding and what that, kind of after look is like. How's our patient doing? How you feeling, Dr. Foley?
So not a big deal. It's just when I have IPL normally done on the face, man, you feel like a rubber band popping, and this is really great. Love this setting. I did get myself with a curling iron this weekend, so it looks like I've done CO2 resurfacing on myself. I have not. That was a burn.
I
will know.
before a wedding 2 weekends ago, I burnt my neck with a curling iron, and I'm just waiting for it to like kind of fully heal so I can go and do stuff to it.
Yeah,
And I'm like, oh, that's good before and after photos.
feels great, guys. Thank you.
Yeah, we got some good darkening of this guy. You're not going to see much like redness from those little settings around the eyes. It's not going to do anything crazy because those are our second pass settings where we should already be having that clinical endpoint. So keep that in mind that you might have a little bit more of, I like to say, you were on a boat all day.
I can already feel the meibomian glands. Those are the oil producers. I can just, oh, wow, that's amazing. So cool. And that is so easy compared to the first setting. It's not bad at all.
I love it.
Yeah.
And then this is your,
So I used up all of my Calm Colon Corrected, and I have not resupplied myself. So I'm going with Do Restore. I was using that on everyone because I'm like, I love this stuff so much. So Do Restore or the Cool, Calm, and Corrected.
We also talked about the new masks that we're going to be starting to play with as well. Do you want to talk about that more?
are they the cynosure masks?
Yeah.
Okay, then yeah, I would love to. Thank you, Dr. Foley. So so this past weekend, and all of Dr. Foley's skincare is branded with her name on it. So if you guys have any questions, if you're a provider on the phone about where she carries it, we're happy to share that, or where she gets it from to carry it. The cynosure actually launched this past weekend at our Cynosure Academy. Our beautiful energy sterile biocellulase full face and neck post-treatment mask. So what this means for a patient is after you get a treatment like IPL done, you are going to feel warm. You're going to feel like you have a little bit of a sunburn. And so this mask is going to come onto your face. It's going to be cold. It's sterile. So we know it's super, super clean. The biocellulase component of it is, I like to describe it as kind of your like plant silk. The silk of the plants. It's super fine, it's beautiful, and it's woven so unbelievably tight that any of those active ingredients on the other side we're putting on your skin are completely held in, and they are not going to be, kind of released out into the air, whatever the term is, when water evaporates. Thank you. Okay, so we don't have to worry about that. We had a journey there. It's okay.
We all went with you, Lauren.
Yes. Okay. So we love those components. The other thing that's awesome about this is that it also covers the neck. So when we're talking about even doing those anti-aging treatments and getting those spots down on our neck, we're going to be able to go ahead and soothe that post-treatment as well. Now, this mask has a lot of actives that will help reduce inflammation. And it also has hyaluronic acid in medical grade concentrations, which essentially means that you will be able to get a ton of hydration post-treatment. It will release a lot of that heat in your skin. And then Jillian will put whatever yummy goodness on your face to kind of double down on that hydration to make you feel extra special when you walk out the door. For our providers on the phone, I kind of touched on it, but the full face and neck and the sterile component of this mask, in addition to the active ingredients for it, is really a big deal. It's not something that you can really find available in this type of formulation. And so definitely reach out to anybody at Cynosure if you want to know anything about it.
All right. And then from Terry, use Dr. Foley's Lash Envy product instead of false eyelashes. Yes, definitely. I don't want to talk bad about Latisse because they have great results, but it's definitely better for your eyes than Latisse. So it's wonderful.
Okay.
Yeah, it works on the peptides versus the latanoprost, which used to be an old glaucoma medication and a different concentration for Latisse. So it causes a lot of ocular surface redness and darkening and irritation. So that's why we're not the biggest fans of Latisse like we used to. All right. Well, gosh, you guys, this has been great. I think that went pretty dang smoothly, and it was just easy as pie.
Yeah,
And
you don't look like you had a treatment done, Dr. Foley. Quit it. You look so good.
I feel relaxed, like I just want to go take a nap now because, she does such a wonderful job. Even just cleaning with alcohol, it feels like a massage. So yeah, I can't lie. Gabby does a really great job. She's fabulous. Well, Amy, I think you're up now. You've got the best part of the evening. You're going to be talking about prizes and all that good stuff. I'm going to let you take it away.
Perfect. Thank you, Dr. Foley. So we are doing 2 prizes tonight. We're doing 1 spot treatment, and then we are doing 1 of our Cool, Calm, and Corrected. Correct. Yeah. I always want to say Cool, Calm, and yeah. Okay. But also, if you would like to have treatments done, either the eye treatments or the spot treatments, it's going to be 20% off. You just need to call now until Friday. Even though Stevie will not be here Friday, you can leave her a voicemail on her voicemail and you will still get the 20% off the packages. For the month of October, our Cool, Calm, and Corrected is going to be 10% off. So you can just come in and, just say that you watched the Glam Girls on the webinar, and we will gladly give you 10% off of that. So let's do some drawings. Are we ready? All right. So the first one will be for the Cool, Calm, and Corrected. I always want to say that wrong. Okay, let's see. Ellen. I don't want to say her last name. So Ellen. Cool, Calm, and Corrected. Yay. All right. The next one is for 1 spot treatment. Will be, oh my gosh, Terry.
Hey. All right, Terry, we're starting that wedding prep now.
That's right. That's right. Let me just write this down because my brain.
You've got the luck with you, Terry. Man, I don't know how it happens. All right. That's great. That's wonderful. You're so cute, Terry. Glamour gals or girls, knock it out of the ballpark again. Learn some new things. Thank you. Oh, we appreciate you so much. And we have another person saying, I am going to be getting treatment for dry eyes and I am concerned about my facial skin looking awkward, meaning where I get IPL treatment versus the untreated areas. I have a lot of different pigment colors and freckles everywhere on my face. What do you think?
That's a great question, Gabby.
So a lot of freckles everywhere. So when we treat the eyes, we go earlobe to corner of the mouth. We get that cheek area on both sides. We get the nose and the forehead. And that is for if someone just has ocular rosacea or they just have rosacea right through here, then that's all we got to worry about. If someone has rosacea on their chin as well, then that's where we opt for a full face. If someone wants to do these treatments, not only for dry eye, but also for beauty treatments, that's also when I say, let's opt for a full face. That being said, if there's like one little spot on your chin where you're like, please get it, then don't tell anyone, but I'll zap it for you. So it kind of just depends on how much we're talking. If we're talking you're covered in freckles, I might recommend get a full face just so we don't leave you with freckles on your chin and then, no freckles on your cheeks. But if it's like one little spot, there's been a lot of times where I'm like, yeah, I'll get that real quick.
You're welcome, Ellen. Thank you for being here.
All right.
Okay. Any other questions people have? These have been great tonight. Golly.
Oh, I love it.
I know. This is really awesome. Everyone's paying attention. You guys are not falling asleep. That's awesome.
How could they? You're too good, Dr. Foley. How could they? I mean, for real.
I have such a great team, and that's where it really comes down to it, is having a fantastic team, having everybody together, sharing the vision. It's really, I think that's what makes it for us. And then having the great partnership with you guys at Cynosure. You've been just wonderful partners and helping us do this. Really, it from the bottom of my heart, I really appreciate it. I've never had this before, and I've been speaking on ocular surface disease for 15 years. So this is truly remarkable technology, and I'm very grateful, very
And
grateful.
the success stories that come from it is just because some of these people come in and we're their last resort. Like they're coming in and they're at the bottom, and we help them, and that's amazing. That's amazing.
Yeah,
Well, go ahead, Dr. Foley.
well, I was just going to say, we today, Wednesdays are usually our OSD clinic day, and we hear some pretty horrendous things, and people have been to 6 or 7 different doctors, and they come in and they're shocked by all of our equipment that we have. But more or less, we have a lot of people that are suicidal. Dry eye, people think it's just like cramps. No, it can be insanely painful. So it makes a world of difference, and that's why we're doing this. And Alan, oh, that's so sweet of you to share your story. You said, I'm a success story. IPL helped my dry eyes tremendously when lots of other things had not been successful.
And there you have it.
That's
why we continue to do it.
Lauren, you were going to say something. I'm sorry.
Oh, no, you're okay. It was kind of along the same lines as the success story. Like even you saying when you're on the treatment table, kind of feeling that relief immediately. I've been benefited by TempSure specifically. That's what I've, treated for my issues. And, I was with a group, and we did a treatment on this young lady who's literally, has last resort situation. She's lucky enough and fortunate enough, the medical spa she works in was bringing in the TempSure for the medical application in the, the med spa space. Her eyes on the table were just seeping the oil release, and she stood up and she blinks, and she's just like, she calls me later. She goes, I was driving on the highway. I've never been able to see the road signs clearly before. It's like she's had sandpaper in her eyes all her life. And I get that. Like, I'm somebody that deals with that too. And I just think, in aesthetics, we often forget, because, right, this will make you really cute and pretty. It'll get rid of your brown spots. It'll get rid of your rosacea. But most importantly, especially for our providers on the phone and even our patients, it'll change the quality of your life. So I love that.
Absolutely.
And thank you, Ellen.
Point.
As someone that works for Cynosure, thank you for sharing that, because it makes us even more excited to do our jobs every day.
Agreed. And Amy sees this with the folks that she has radio frequency with. And as folks know, we have both radio frequency and IPL. Gabby is our IPL laser specialist, 1540. You name it, she does everything. And Amy is our specialized on our radio frequency. So she gets a little bit more time with patients, a little more soothing. It's a little more spa-like.
Yeah, they like to talk through mine, where Gabby's, they're like, just get it done, get it done, get it done.
Get it done.
No talking, just do it.
And I get to listen to them.
I remember we had one patient come in, and she hadn't read a book in 10 years because her eyes were so dry. I think by the 3rd treatment that we did for her, she had already read 2 books. So we cried together. I was like, oh.
Yeah, I didn't show up to cry here today, Amy. My gosh, you're gonna make my waterworks go. Oh, I love it.
It's true though. We forget how much the eyes are the windows into our soul. 80% of our life, in order to do anything, requires vision. And the ocular surface is the first refractive surface. So if that's unstable, your vision's unstable and you can't see clearly. So this is just a gigantic leap forward from being dependent on artificial tears, being dependent on prescription eye drop medications that don't really address the main issue of inflammation and rosacea. So the combination of IPL and radio frequency can be just piece de resistance, right? And or sometimes we have to do just radio frequency. Yes. And as you guys can see, I don't look red, I don't look crazy. I could just, put on my makeup immediately and go forth and have fun. Of course, I am too old to do that these days. I learned that in Vegas this weekend at our Cynosure Academy meeting. I'm like, oh la la, I am really getting old. Yeah, yeah. But I'm going to fight it every step of the way now and keep my eyes glowing and feeling great too. Well, gosh, guys, I think this has been wonderful. I think we've answered everybody's questions. Oh, Terry, you're just so sweet. Treatment at Dr. Foley's does make you cry with relief and vision, exclamation point. Oh, and you're too sweet to say I don't need makeup. You are so lovely. But I have been getting treatments, so that does help. I had one patient the other day told me I have to change the picture on my website. He said, he was a male patient. You look too old, Dr. Foley. I go, well, that was before I started having treatments. And that's my secret now. So yeah, I gotta change it. Gotta change it up. All right, you lovely, wonderful glamour gals. I really appreciate each and every single one of you. Lauren, this has just been such a treat. And we'll be back next month with Radio Frequency. We're going to be really having some fun there and giving away some more prizes. So stay tuned. Sign up for next month. It's always the last Wednesday of every month. And then come 2023, we're going to be doing this over the lunch hour on the last Wednesday of every month. So just kind of reminding everybody we're going to be doing that. But we're going to have a great time. And usually Stevie has us, you know, with some crazy got the power kind of sound going, but we'll just remember, you know, in our heads there. So enjoy, everybody. Have a great, wonderful rest of your week. Have
Thanks
a
for coming,
fantastic
everyone.
weekend.
We appreciate
Yep.
the support. Thank you so much.
Definitely. We appreciate it as well. I'll be lecturing in Newport Beach this weekend to a Gene conference. So, oh, I'm on the move. So we may be posting some things about all the different conferences and things that I'll be speaking at. So looking forward to seeing you guys, all of our patients. We love you. We enjoy being with you. Boy, it's my whole social outlet, guys. I've become an empty nester. So I am here. I want to talk. I want to see you. And I just really appreciate each and every one of you. So thank you so much. Good night.
Good night, everyone.
Thank you. Good night.
Thanks, Lauren.
Bye. Thanks, Lauren.
Bye, ladies.